Hey everyone, this is my case study on an environmental factor that impacts a patient's health. So while I was shadowing at University Medical Center in Tuscaloosa, I encountered a 65-year-old Black male from Tuscaloosa, Alabama, who presented with concerns about weight loss. And over the course of 1 year, his weight reduced from 134 pounds to 129 pounds. So the history of his presenting complaint, though it does not seem connected right now, it'll make sense at the end. The patient has lung scarring from chronic obstructive pulmonary disease. He has lung nodules from sarcoidosis. He has a history of prostate cancer, and he also has polyps that were found in a previous colonoscopy. And something to note about this patient is that he consistently refuses to follow up from this colonoscopy and has not had one since. I don't know when that colonoscopy happened. That was not shared with me. So some other past medical history that is not pertinent to this chief complaint is that the patient does have sickle cell trait. And in this picture, you can see what a sickled red blood cell actually looks like. And arteriovenous malformations were found in his colon as well. And all that is just vessels that aren't connecting properly. There's just abnormal vessels in the colon, and this is related to his microcytic anemia, which just means, small red blood cells that also cause him some problems. And some of his social history is that he is a current cigarette smoker and he reports the use of marijuana. So a side note from the resident that is also important to note is that the physician mentioned that this patient is a hypochondriac. She said this to me before we went in the room. She said that hypochondriac is just an outdated way of saying illness anxiety disorder is what the patient has. And she said this because this wasn't his first time coming to the doctor complaining of weight loss. And the weight loss in this case is not significant. And so his persistent worry about weight loss is just difficult for her to evaluate because, yes, it's not significant. And so just the persistence is why she mentioned this. That'll be important later. So the background for unintentional weight loss is that it's just weight loss that happens involuntarily over time, and it occurs in a third of patients over the age of 65. It has different causes, but the most common are cancer, psychiatric disorders, gastrointestinal disease, and unknown causes. It's common that they don't know why it's happening, and it significantly increases the risk of adverse outcomes in elderly patients. And to treat unintentional weight loss, you must figure out what the cause is. So treatment can look different for different people. So sarcoidosis is an inflammatory disease that causes clusters of white blood cells called granulomas to appear in various parts of the body. And the most commonly affected area of the body is the lungs, and lung fibrosis happens in a fifth of the affected population. The cause is not known, and this sarcoidosis can present in a nodular form, and this presentation is responsible for sarcoidosis being called the Great Mimic, and because it often mimics lung cancer and other lung diseases, which is important to note for this case. But to know whether these nodules, which are less common than cancer and other diseases, just to know what they're caused by, you have to have a biopsy. And but if it is sarcoidosis, it is something that doesn't usually impair the patient. And if breathing issues are present, steroids can be administered, but it is something that usually resolves on its own. So again, the cause of this is not known. Sarcoidosis is not really a problem, but it can cause concern for cancer if a patient has this and they don't know it. So chronic obstructive pulmonary disease It's a disease where airflow in the lungs is limited by tissue damage, and this damage is caused by inflammation from chronic exposure to harmful gases and particles, usually cigarette smoke. And it's most common in smokers above the age of 40. And to treat COPD, you focus on symptom management with medication, pulmonary rehabilitation to improve breathing and just perfusion. And smoking cessation is important to improve COPD. And in severe cases, surgery can be done. For colorectal cancer, important things to know are this is the second leading cause of cancer-related deaths globally, and it develops from precursor lesions like polyps. And significant risk factors include being above 50 years old, being Black, being male, and chronic smoking. There are other risk factors, but I just included the ones that are pertinent to this case. And colonoscopies are the most effective way to screen for colorectal cancer, and they do reduce morbidity and mortality. And a colonoscopy is just a way to visualize the colon and allow for the endoscopic excision of lesions like polyps. And more favorable survival outcomes are possible for those that are getting colonoscopies in earlier stages of their cancer. And so, to understand prostate cancer a little more, we need to know that it is the second leading cause of cancer-related deaths in United States males. And risk factors for prostate cancer, of course, being a male and being above age 50. 90% of cases occur in men over the age of 50. And it's also 2 times more common in Black men than other races. Something positive to note about this is that 99% of people with prostate cancer do survive 5 years after their diagnosis. And to treat prostate cancer, if it's not too severe, it can just be monitored. And you can also use radiation, chemo, and surgery to treat prostate cancer. And to understand illness anxiety disorder. I'm sorry, it's a lot, but I promise it will all come together. This is a psychiatric condition where a patient would present with just excessive worry about having a serious condition, or they present with persistent fear of illness despite having been evaluated and tested, and the results come back normal. Some risk factors for having this disease are coming from a family with frequent health anxieties, coming from parents that face disproportionate health concerns, and the prevalence of illness anxiety disorder is not known because it is a relatively new diagnosis and more studies need to be done on this disorder. And to treat illness anxiety disorder, it's recommended that primary care physicians establish rapport and therapeutic alliance with patients to help them open up. And psychotherapy like cognitive behavioral therapy and medication as a second line of treatment are recommended as well. So just to review before we discuss this patient has scarring in their lungs from COPD. They also have lung nodules from sarcoidosis. They have a history of prostate cancer. They have polyps from previous colonoscopies. This patient hasn't had a colonoscopy in a while. And also the physician suspects illness anxiety disorder. This patient is a smoker and a 65-year-old Black male. So what does all this mean about his environment? Smoking is the biggest concern of this patient's environment. Although his weight loss is insignificant and he comes in commonly complaining about this, his age and his history still cause concern for cancer. His cancer risk is elevated because of his history and because of his smoking. And it's noteworthy that smoking is an environmental factor that is harmful to almost every organ in the human body. It's going to exacerbate his COPD, it elevates his cancer risk, and it's impacting his health, and it's evident. and a not so obvious environmental concern of this patient that I have. I do want to disclaim that I'm just guessing that this is going on, but but I will support why I'm saying this is that I think medical mistrust could be contributing to his illness anxiety disorder. We learned that people from families with elevated anxiety and health concerns, or parents that face disproportionate health concerns, are at higher risk for illness anxiety disorder. And because our patient is a Black male from the South, from Alabama, where things like the Tuskegee syphilis study happened, um, it can contribute to medical mistrust, as we can see on this slide. And I just recommend that the physician at least just take a more extensive social and family history from this patient to just understand him better, where he's coming from and why he's hesitant to get his colonoscopy, and maybe just to understand his concerns a little better. Again, I'm just curious if his social environment contributes to his anxiety. I also recommend that he pursue getting a colonoscopy to just rule out the possibility of colorectal cancer, because he is at elevated risk with having already had polyps and a history of cancer, prostate cancer. And his weight and symptoms should continue to be monitored. And above all, he needs to stop his biggest environmental factor that is causing or just contributing to a lot of his health concerns, and to stop smoking. Right? And these are my references. Thank you, guys.